A 45-year-old man presents to his general practitioner with dizziness and right-sided hearing loss. Since the onset of his symptoms, he has also noticed some right-sided facial numbness. He is FAST negative. So FAST stands for facial asymmetry, arms, speech, and T stands for time sensitive. However, on cranial nerve examination, he has an absent corneal reflex on the right and right-sided sensorineural hearing loss. Ear examination is unremarkable. He is referred to the hospital for further investigation. What is the likely diagnosis? Dizziness, right-sided hearing loss. So I'm guessing either the brain or the auditory nerve is right side auditory nerve is involved. Right-sided facial numbness. So sensory of the facial area is by the fifth cranial nerve. What's the fifth cranial nerve called again? Is it a trigeminal nerve? He's FAST negative. However, cranial nerve examination absent corneal reflex, so 5-1 is affected on the right and right-sided sensorineural hearing loss. So cranial nerve 8 is affected. Ear examination is unremarkable. It's sudden onset. Could be a CP angle tumor or how's the onset? No mention about the onset. Could be a not Guillain-Barré syndrome because this usually starts in the legs. Ramsay-Hunt syndrome, what's that again? I think it's shingles affecting your cranial nerves as well. Meningioma can cause compression at the CP angle if it's a CP angle meningioma. Trigeminal neuroma. Vestibular schwannoma. I think it's less likely trigeminal neuroma because the hearing is affected more than the numbness. No, it doesn't say. Which one? Vestibular Schwannoma. It will cover the dizziness and right-sided hearing loss for vestibular schwannoma. Can vestibular schwannoma compress on the fifth cranial nerve? I'm not sure. Can the fifth cranial nerve neuroma compress on the vestibular nerve? Or vestibular cochlear nerve? Not sure. But meningioma can, a CP angle meningioma can compress on both. No, the answer is vestibular schwannoma. Cranial nerves 5, 7, and 8 are affected in vestibular schwannomas. Vestibular schwannoma or acoustic neuroma accounts for 80 to 90% of cerebellopontine angle tumors. Oh, okay. This patient is presenting with symptoms affecting several of his cranial nerves. He has vertigo and unilateral hearing loss, indicating cranial nerve 8 involvement, absent corneal reflex, indicating cranial nerve 5 involvement, unilateral facial numbness. Numbness? Sensory of the face. Isn't it trigeminal? Cranial nerve 7 is motor of the face. What does numbness mean? You can't feel anything, right? Weakness or paralysis is cranial nerve 7 problem. But numbness, probably not cranial nerve 7. Small cranial nerve 5. Guillain-Barré syndrome typically presents with distal progressive weakness, which move proximally. It does not usually feature vertigo and hearing loss. Meningioma may cause similar presenting symptoms and account for 5 to 10% of CP angle tumors. Okay, so meningioma is correct as well, however, it's less likely than vestibular schwannoma or acoustic neuroma. Ramsay-Hunt syndrome is a reactivating of pre-existing varicella zoster virus in the geniculate ganglion. Can present with tinnitus, vertigo, facial paralysis, loss of taste, and dry eyes. In examination questions, there will commonly be references to tympanic membrane vesicles. What is the geniculate ganglion? Geniculate ganglion is cranial nerve 5, right? Yeah, it is 5-3, 5-1, 5-2, 5-3. It's very big cranial nerve. This is cranial nerve 8, I think. Geniculate ganglion is here. Okay. A trigeminal neuroma may cause trigeminal symptoms such as facial numbness and absent corneal reflex, but do not typically cause sensorineural hearing loss. So let's look at the anatomy of a trigeminal neuroma. Where is it? Let's see, where does it compress? Yeah, so it's here, so it doesn't compress on the 8th nerve. However, if it's a vestibular schwannoma, yeah, it does compress on the 5th nerve. Compresses on the brainstem even. Oh, it's big. This is big. So it compresses on the 5th nerve. 5th cranial nerve. It's big. Vestibular schwannomas or acoustic neuromas. Vestibular schwannomas, sometimes referred to as acoustic neuromas, account for approximately 5% of intracranial tumors and 90% of cerebropontine angle tumors. The classical history of vestibular schwannoma includes a combination of vertigo, hearing loss, tinnitus, and absent corneal reflex. Features can be predicted by the affected cranial nerves. Cranial nerve 8, vertigo, unilateral sensorineural hearing loss, unilateral tinnitus, cranial nerve 5, absent corneal reflex, cranial nerve 7, facial palsy. Bilateral vestibular schwannomas are seen in neurofibromatosis type 2. Patients with a suspected vestibular schwannoma should be referred urgently to ENT. It should be noted, though, that the tumors are often slow-growing, benign, and often observed initially. MRI of the cerebropontine angle is the investigation of choice. Audiometry is also important, as only 5% of patients will have a normal audiogram. Management is either with either surgery, radiotherapy, or observation. Okay,